So when we want to acquire images on the patient's right side, we're going to position the sensor guard on the left side of the patient's mouth. And we're going to wedge this guard in between the upper fourth premolar on the maxilla and the molar 1 on the mandible. So we're going to open the patient's mouth and we're going to put the tips of those crowns right along the ridges here. Very easy to position with the tether coming out of the front of the mouth. And now we're ready to acquire the images on the patient's right side. Here's what that looks like close up. Now that we have the sensor guard positioned on the left side of the mouth, we can begin acquiring images here on the right side. And for our maxillary premolars and molars, we're not going to need positioning devices to help us keep that sensor parallel to the palate. So I've got my sensor wrapped in vet wrap here. It provides some extra gripping and protection. And now I'm just going to slide that sensor in, and now we're ready to acquire these images here. Now, when we start moving forward to these first, second, and third premolars, we are going to need something to help us keep that sensor parallel to the palate. So what I like to use is a paper towel or gauze, and I go ahead and I place that underneath the sensor, and now I can position that right underneath that first, second, and third premolar. And then I can continue to move this sensor forward and acquire all of the images here on the patient's right side, along with all of the incisors. And then when I'm finished acquiring the right side up to the incisors, I'm going to take that sensor guard and I'm going to move it over here to the right side of the patient's mouth with the tether forward. And now I'm ready to begin my images here on the patient's left side. So if you're acquiring images with the patient in lateral recumbency, whether you're doing the maxilla or the mandible, what you're going to do is you're going to place the sensor guard on the right side of the patient's mouth, and you're going to put it in between the upper fourth maxillary premolar and the mandibular first molar. So what you'll do is you'll come underneath here and you'll open up the mouth just a little bit, and you'll go ahead and place the tips of the crowns of that upper fourth premolar on the top part of the guard, and on the bottom part of the guard where the ridges are, you're going to put the tip of the first molar. And now your patient's mouth is nice and propped open, and your sensor will be protected, and you can begin acquiring your images. So with our guard positioned on the right side of the patient's mouth, now we can come in here and do our lateral views. Whether we're working on the mandible here, and we can just bring this forward all the way around to the incisors, we can acquire this patient's left side. And then if we are doing our maxillary views in lateral recumbency, we would just need to use some paper towels or some gauze to help us keep that sensor stabilized. We do this without mouth props too. So that's how we would position here. And so that guard really prevents the mouth from closing should a patient become light. And now we can just go ahead and acquire these images all the way around to the incisors here, and then we can place our patient in lateral recumbency on the patient's left side. We'll position our sensor guard over on this side, and we can acquire the rest of the images on the other side of the patient's mouth. So if we're acquiring our images with the patient in dorsal recumbency, whether we're doing our full mouth with the patient in dorsal or if we're doing the mandible in dorsal recumbency, we're going to position the sensor guard the same exact way as we would with our lateral or sternal views. So we're going to put the tips of the crowns on these ridges here, and we're going to use the same teeth that we do for those other images. So we're going to wedge this guard in between the first molar crowns and the upper fourth premolar crowns. And now Our tether is coming out the front of the patient's mouth, and we're safe to use our sensor on the patient's right side. Now that we have our sensor positioned on the patient's left side of the mouth, we're safe to begin acquiring images on the patient's left mandible. We'll start with the caudal aspect, and we can now position our sensor for these caudal maxillary teeth. Once we get that sensor in place, we'll need things like positioning devices to help us keep that sensor stabilized. And we do this regardless of whether or not we're using a prop. So we position that in the mouth. Now our sensor is stable, and we can begin acquiring these images. And then we'll just continue to move this sensor forward, and we will also need the use of those gauze squares or paper towels to help us keep that sensor touching the crowns of the teeth and parallel to the palate.